Hello everyone, myself Dr Namrata Vithalani. I am practicing as a physician at Riaan Clinic Surat. In this video, we will discuss regarding the occurrence of hypoglycemia in patients with the complicated malaria, especially Plasmodium falciparum malaria. So, in complicated malaria, hypoglycemia is often a frequent occurrence as we do monitor blood glucose in our all critically ill patients or ICU patients. Frequent monitoring of blood glucose, it is of utmost importance in patients with the complicated malaria too, because unrecognized hypoglycemia, it may lead to seizures and it may even lead to permanent neurological sequelae. So why hypoglycemia? It is common. So complicated malaria, it is often a hypercatabolic state, and there is a increased glucose utilization by the infecting parasites, and because of the cytokine induced inflammation, there is a limited or diminished gluconeogenesis, and there is an increased peripheral glucose utilization by the parasites, and often due to starvation or anorexia, vomiting, diminished oral intake, there is a hypoglycemia often. So there is a diminished production, increased utilization and diminished intake. Often it may be iatrogenic also, say for antimalarials such as quinine, it is having a secretory effect like sulfonyl, where it increases the insulin secretion. So it is often one of the contributing factor for the hypoglycemia in patients with the complicated malaria. And even organ failure such as kidney failure or liver failure, that might also contribute to the occurrence of hypoglycemia. So why it is important? So hypoglycemia in patients with the complicated malaria, often when associated with the circulatory collapse or shock or metabolic and lactic acidosis or organ failure such as liver failure or kidney failure, it is an important poor prognostic indicator for mortality. So we should do frequent blood sugar monitoring in all the patients with the malaria, especially complicated malaria. And how do we treat it? If we recognize, if patient is able to take orally, we should supplement the glucose orally or by the Ryle's tube feeding. And if very sick, we should, along with the Ryle's tube feeding, we can give the IV boluses of such as 25% or 50% dextrose, or a continuous IV fluids like 5% dextrose, glucose rich fluids, or the IV infusions containing 25% or 50% dextrose depending on the clinical severity. Thank you.